Marley Drug.
Hi, my name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. Today we will discuss a popular prescription medication that has been on the market for nearly 30 years called atorvastatin, also known as Lipitor. Atorvastatin is part of a drug class of medications known as HMG-CoA reductase inhibitors, or statins for short. When it comes to lowering cholesterol levels, statins, including atorvastatin, are often the primary medications prescribed. Now let's discuss how it works. Atorvastatin is FDA approved for treating high or bad cholesterol and triglyceride levels and reducing the risk of cardiovascular diseases such as heart attacks and strokes, particularly in high-risk adults, including those with diabetes or high blood pressure. So this medication works by blocking an enzyme called HMG-CoA reductase in your liver. By doing so, it reduces your liver's production of LDL cholesterol, also known as the bad cholesterol, and increases the number of LDL receptors on liver cells, helping to clear more LDL cholesterol from your bloodstream. This helps lower LDL cholesterol levels and decreases the risk of plaque buildup in the arteries, ultimately preventing heart-related problems. Atorvastatin can also increase high-density lipoprotein, or HDL levels, also known as good cholesterol, and decrease your triglyceride levels. It is important to keep in mind that developing a healthy and balanced diet low in fat and maintaining a consistent exercise regimen is important while also using atorvastatin, as this maximizes the medication's effectiveness. Let's now move on to dosing and administration. Atorvastatin is available in tablet form and can be taken by mouth with or without food. However, if this medication is upsetting your stomach, try taking it with food to help. Note that certain statins have greater potency, allowing them to achieve more significant reductions in cholesterol levels compared to others. Atorvastatin is classified as a moderate to high intensity statin. At specific doses such as moderate intensity, which includes 10 or 20 milligrams, atorvastatin can lower LDL by approximately 30 to 49%, and at high intensity, including 40 or 80 milligrams, atorvastatin can lower LDL by at least 50%. Your healthcare provider will assess whether atorvastatin is appropriate for you based on factors such as concurrent medications and the severity of your LDL cholesterol elevation. Atorvastatin, being a long-acting medication, maintains its effects consistently throughout the day, and you have the flexibility to take it either during the day or at night. If you do forget to take your atorvastatin dose, take it as soon as you remember. However, if it has been more than 12 hours since your scheduled dose, skip the missed dose and take your next one at the usual time. Do not double up on doses to compensate for a missed one. Like all medications, atorvastatin has a few side effects. Some common side effects may include myopathy, which is a skeletal muscle disorder, myalgia, which is muscle pain, arthralgia, which is joint pain, cognitive impairment, headache, sore throat, runny nose, insomnia, nausea, heartburn, indigestion, constipation or diarrhea, pain in your arms and legs, muscle pain or spasms, insomnia, pain while urinating often, or symptoms of a UTI. If you are experiencing any of these side effects, be sure to talk with your healthcare provider to determine whether a dose adjustment or switching to a different medication would be beneficial for you. It is also possible for atorvastatin to cause serious side effects in some. It is important to be aware of these potential risks and to receive medical attention immediately if any serious side effects occur, including severe muscle damage known as rhabdomyolysis. Symptoms may include dark brown urine, severe muscle weaknesses or pain, fever, or tiredness. Difficulty raising your arms and/or difficulty rising or standing. Muscle aches in your hips, shoulders, neck, and back. Hepatic or liver issues such as abdominal pain, weaknesses, fatigue, decreased appetite, dark urine, and jaundice, which is yellowing of the skin or the whites of your eyes. Atorvastatin has the potential to interact with numerous medications, including antiviral medications used for HIV, such as ritonavir, cholesterol-lowering drugs such as gemfibrozil and fenofibrate, antifungals or antibiotics including azithromycin, rifampin, clarithromycin, erythromycin, fluconazole, and itraconazole, or medications used for gout, including colchicine. Before starting atorvastatin treatment, make sure to inform your healthcare provider about all your medications. Avoid starting any new medications while taking atorvastatin without consulting your provider or pharmacist first, as they will assess the safety of all medications for you. It is important to be aware that grapefruit and grapefruit juice can interact with atorvastatin and increase your risk of side effects. So to briefly summarize what we discussed today, atorvastatin, also known as Lipitor, belongs to a class of medications called HMG-CoA reductase inhibitors, or statins, which are commonly prescribed to lower cholesterol levels. Approved for treating high cholesterol and triglyceride levels and reducing the risk of cardiovascular disease such as heart attacks and strokes, atorvastatin works by blocking an enzyme in the liver called HMG-CoA reductase. This action reduces the liver's production of LDL cholesterol, or bad cholesterol, and increases the number of LDL receptors on liver cells, helping in the clearance of LDL cholesterol from the bloodstream. This action lowers LDL cholesterol levels, decreases the risk of plaque buildup in arteries, and can increase levels of HDL cholesterol, or good cholesterol, while decreasing triglyceride levels. It is important to maintain a healthy diet and exercise routine while taking atorvastatin to maximize its effectiveness. Atorvastatin is available in tablet form and can be taken with or without food, although taking it with food may reduce stomach upset. Atorvastatin is considered a moderate to high intensity statin, with varying doses having different effects on LDL cholesterol reduction. Missing a dose should be avoided, but if a dose is missed, it should be taken as soon as we remember, unless it's close to the next scheduled dose. Common side effects include muscle and joint pain, headache, nausea, and gastrointestinal issues, while serious effects like severe muscle damage, known as rhabdomyolysis, and liver problems can occur rarely and require immediate medical attention. Atorvastatin can interact with various medications, so it is important to inform healthcare providers of all medications and supplements being taken. Additionally, interactions with grapefruit and grapefruit juice should be avoided. You can read more about cholesterol or cardiovascular conditions on our website. Check those articles out in the links below. If you have any questions about atorvastatin or statins, be sure to ask your healthcare provider or leave them in the comments below. And don't forget to subscribe. Bye for now.